So today we will position the artificial teeth on the upper maxillary. Those are the teeth. I choose the teeth that I'm going to use. The teeth set from which I take what I need, right? So first I have to make sure that the teeth are not too long, and I will trim from the mucosal aspect of those teeth. They come as standard, obviously, they're standardized, but I have to remove a little bit in order to make sure, slowly, to make sure that there's no premature contact, and the tooth will not stay too high in occlusion, so to say, or too low in occlusion, the way you want to call it, because it's low because it's a maxillary, right? So we will pay attention for the two central incisors to have the same shape at the cervical region, to be symmetric. So it has to be removed with care, carefully. So this has to be done carefully, and it may take time. The technician already did that before. So now we kind of see the final result, right? So the technician is checking every tooth individually to see if it fits, if it's not too long. If it is, he has to trim from the cervical part, which is the case with this lateral incisor. And the technician must know where to trim from the labial aspect or more from the palatal aspect. But always it's from the mucosal aspect of the teeth. More to the labial, more to the palatal, more in the middle. That's something that the technician has to decide, guessing where this tooth will touch the plaster, the model, if pressed in. So you see the technician is working slowly, like Italians are saying, poco poco, mano a mano. That's easily, slowly, because if you trim too much, then you can't replace it. I mean, you have to buy another set of teeth. So now the technician is happy with what he has. The next step is to place the teeth and to mount them, which will be done by heating the wax, obviously. In order to correctly place the teeth, you have to know how and where to mount every individual tooth. There's a general rules and individual rules according to every tooth on the dental arch. So always you start with the central incisors. In this case, I will start with the central incisor in the first quadrant, because I have lateral incisor there, so I know where to place it. And the technician is starting by softening the wax there, melting it, not completely, but enough to allow him to place the tooth. You see, there's not much space, so he doesn't need to add a lot of wax there. This is very important. So the technician is placing the tooth in the desired position. What we should know about the central incisor is that the inclination of 5-8 degrees, and mesiodistally is inclined like 2-3 degrees. So the incisal margin is 1 to 3 millimeters out on the labial, comparing to the cervical part of the tooth. At the same time, I'm interested that it is 0.5 longer to 1 millimeter longer than the length of the lateral incisor. If I'm not sure, I can take a ruler and just measure. It's more than 1 millimeter, so it means that I have to lower it a little bit by melting a little bit the wax. You see, I don't add a lot of wax because that would raise the tooth. I want my tooth to sit in position as nicely and as quick as possible. I don't need excess wax in this case, right? Most of the times we don't need more wax to be placed. Once the position is satisfactory, I can fix it with wax at the base to the pattern, to the wax pattern. I always take care not to cover the cervical region of the teeth with wax, because if I do that, I may be tricked as to the axis of inclination in both directions, but especially mesiodistally. So I remove the excess wax to make me able to see the margin at the cervical region. That will tell me exactly the position of the tooth. I can see it completely. And on the other hand, I want the cervical margin to be similar with the cervical margins with the remaining teeth. Now the second central incisor, that's the homologue, what we call it, and pay attention, it has to be a little bit inclined towards the other one, right? So the two central incisors, they have to be inclined one towards the other. Okay, that's the second central incisor from the second quadrant. Their incisal edges have to follow the curvature of the whole arch. So be a continuation of the incisal margins of the neighboring teeth. At the same time, I have to check that they are equally high or low, that they are at the same height. If not, I should add or press. Now in this case, the technician realizes that he has to add some wax. This is a very interesting way of checking. You mimic the lip with your finger. See if it is horizontal. You can use a plate, a glass plate, to check this. There's more ways to do that. But now, just as you look at that, normally the technician is doing that with a model mounted in the articulator. This is just our demonstration, but in this moment, this has to be placed in the articulator, because otherwise you don't know if the bite is right when you place those teeth. That was very important to mention. So now again, the technician needs to modify a little bit, to put a little bit more wax, and replaces the tooth. But again, this has to be done taking the occlusion into account. So this should be mounted on the articulator as we saw in the previous movie. But now this is just a demonstration of how teeth are placed without discussing about the antagonists. Right, it's important to know. So now I fix it, I do the final fixing with wax on the wax pattern, on the base of the wax pattern. And I keep going with the lateral incisor. Of course, the choice should have been right about the thickness of the teeth, otherwise they couldn't have fit there. So when you choose the denture, you choose the right measurements for the teeth in order to make sure that they fit in. The lateral incisor is more inclined. Buccal palatal inclination, even more. It's like 6 to 10 degrees. But also a mesiodistal inclination, which is also in between 3 and 5 degrees. So the cervical region will be way more distal. And also the cervical margin will be lower than those of the canine and of the central incisor. So the technician needed a little bit more wax. Now places the tooth into position. Now if I draw a line with a pencil, I say that the incisal edges are one single arch. Okay? One single arch. There's no steps in there. And now, once I position the teeth, I start to fix them for good in the wax. And to create the modeling of the buccal aspect of the denture. This is very important to mimic the papillas, because that's what gives a natural aspect to the whole denture. And of course it depends on relative to the age. You won't have nice papillas in very old patients, obviously, while for young patients they're better contoured and they're longer in between the teeth, while with the older patients they're shorter. They don't go so much in between the teeth. Now this is just the modeling, but normally you can even paint that or even add composite and different colors of composite. You can do really artistic work also on the gums, not only related to the teeth. So now we have to mimic the root under the bone. Where there's the root, there's more convex shape, bulky shape. Where there's the interroot parts, it has to be less bulky. So now it's artistic touch. That's it. In both gum and tooth or teeth. On the palatal, the design should be as simple as possible, non-intrusive, so to say. We don't have to cover the teeth in wax. The link between them and the base that will replace the wax is a chemical link, not a physical one, so it doesn't need retention or something. Well, many technicians do it, but it's just for an extra strength of connection. But otherwise, everything is chemical there. Nonetheless, it's good if the technician does also some mechanical retentions. Now I come on the labial. I clean nicely the margin, the cervical margin. So this is actually modeling the papillas and the gingival margin of the denture. From time to time, I put my scalpel in the flame and then wipe it on the tissue on the table in order to get rid of wax residues on my instrument. And in the same time, although we want it physiognomical, this part of the denture, we have to do a compromise, because if it is too expressive, it will cause the food to stick there, which we don't want. So you have to keep the balance between aesthetic and functional. It should not push the upper lip, on the other hand. So, but in the same time, we want to keep it naturally looking, right? So an experienced technician will find the way. A little bit of hot air pumping there to make everything smooth and level. So now this part is ready to go in the office for the dentist to check if everything is okay in the patient's mouth. Now you'll say, what can be wrong here? Well, just wait and you'll see in the clinic. Yeah. Well, in such a case, little can be wrong. That's true, because you have the position of the remaining teeth, so that tells you a lot about the position of the teeth that you're putting now in the denture pattern base. But it's always important for the dentist to check. It is always done. Now you see the technician is always removing the wax in only one sense. Only like this can he obtain a very smooth wax in that region. And then again, pumping hot air. So it's smooth, which makes it comfortable for the tongue. Next time, we'll place the teeth on the laterals, on the molar region. Thank you.